The skillful communicators develop a sort of nose twitch about how far to push different amounts of information. I think that information about genetic sort of risk and assimilating the implications of that, the consequences of taking different sorts of actions, can only be seen as a process.
I think what Leslie says about a good information giver has a nose for how much to say and how much not to say and so on is absolutely essential. And certainly I was entertained really by watching the two people who were giving me the news, watching them working one off the other, and I say, I know what you're doing, you know. But it's so much of this, I think, depends on the skill of the people who are giving the information and the nuances that they're able to bring to that in reading whoever it is who's sitting in front of them. I think that part of the problem is that the professionals who are giving the information frequently are so familiar with it that what they perceive as, for example, a low risk or you're all right, Mrs. Really, is not the way the other person perceives it. And they're just the very fact of their familiarity prevents people from understanding what the person in the room is hearing. Yes. And I think there's such a great deal to be done yet of persuading, if persuade be the word, the professionals to not just to listen to women, but actually to convene groups of people and to try and be informed, not necessarily by people like us who've been through quite a lot of this, but by people who haven't been through it, and just looking at things hypothetically even, just looking at how populations get information and how they interpret general information, whatever that is. I just think there's still an enormous way to go on that, and if that was pursued with more vigour, certainly in Ireland, I think we'd have better outcomes.
Yeah, I think you're absolutely right that people who are in the health services, become inured to the language they use and forget that the rest of the world haven't got a clue what they're talking about half the time. I hate, when we're looking at sort of trying to help people become better communicators, I hate these textbooks that make it all sound so simple. Establish eye contact, greet the patient, like this cookbook stuff. Rubbish. We don't actually interact with everybody else we meet in the world in that sort of regimented fashion. You'd be looked at sort of rather strangely if you did. The people who are going to help their patients most of all are going to be those who can see quite quickly that the person really isn't with them and has got a vast repertoire of different ways of describing things. Beware the person who can only describe things in one way. And we have got so many wonderful ways now, I think, with graphics and cartoons and everything, to find different means to help people understand in ways that are appropriate for them.